Hey everyone, my name is Marielena Hercher. I am a doctor of physical therapy and I'm here to talk to you about pacing in chronic pain. Pacing is basically developing a system to help us manage our energy levels so we can get the tasks done that we need to complete in a day. This consists of two parts. So one is conserving energy for the things that we want to prioritize, like playing with our kids or getting dishes done or working on some sort of like recreational project we have in mind. The second part is actually setting quotas for those activities that we can reasonably complete on most of our good days, and then sticking to them over time and gradually increasing them. So our goal with this is to gradually increase our tolerance to those activities over time, and instead of reacting to our symptoms of pain, we're using a more measured approach, time-based, that's going to place limits on when we stop our activities. The thinking behind this is that by placing a limit on our activities using time and not our symptoms, we avoid this kind of boom-bust cycle where we feel really good, so we do a whole lot of activity and we end up overdoing it, so then we stop doing that activity entirely for days or weeks or even months, and then it takes a whole lot to get back into it. So there's a couple different steps to pacing, but it's pretty easily broken down. So the first thing we want to do is set a baseline, and we're going to need some data or some measurements to set our baseline. I usually tell people if over the course of a week or so, you can get maybe 3 measurements of the task that you need to do. The example that I'm going to use is washing dishes. So let's say you end up having to wash dishes every night. So for 3 nights in a row, you can see, all right, how long can I wash dishes and still feel okay? So say the first night it's 15 minutes, the second night it's 20, and then the third night it's 25 minutes. So we want to look at those 3 days and come up with an average. For me, that average falls around 20 minutes before I start to feel my symptoms come on. So we're not going to start with that 20 minutes, although it sounds good because it's right in the middle. What we're going to do is we're going to take 20% off of that. So let's say instead of starting at 20 minutes, I start with 15 or 16 minutes. So I do the dishes for 15 minutes and then I stop that task and I give myself a break. And for the first week, you stick to that 15 minutes. Once you hit that 15 minutes, you give yourself a break, and if there's more dishes to do after that, you come back to it once you've rested. The important thing here is that even on our good days, when we feel like we could go for way longer, we're gonna stick to that 15 minutes. That's gonna allow our body to habituate to this level of activity so that hopefully, eventually even on our bad days, we can still make it to that 15 minutes. The next thing we wanna do is increase our level of activity over time. So if we're able to do that 15 minutes for the first week, the next week we're gonna add 10%. So the easiest way to do this calculation is to just take your number, let's say I'm starting with like a 20-minute increment, and put it into your calculator and multiply it by 1.1. That's gonna add 10% on. So 10% of my 20 minutes is gonna be 2 additional minutes. So in my second week, instead of 20 minutes of washing dishes, I'm gonna wash dishes for 22 minutes before I take my break. So it sounds really simple, but there are lots of pitfalls that come with this kind of thing. People tell me all the time, well, I felt really good and I lost track of time and I overdid it. So set an alarm on your phone or keep a clock somewhere near you so you can look up and say, okay, the time has elapsed. Even though I feel like I could keep going, I'm gonna give myself the rest that I need before I come back to this task. Or let's say the repetitiveness of one task really does bother you. So when you get to your time increment for that task, you task switch and do something that is gonna say, be less heavy on your upper body or your lower body so that you can switch off between the two. You may also want to create a list of priorities. So figuring out what needs to get done in the next hour, what can be done later today, and what can maybe be placed to a different day of the week if my energy levels or my pain levels won't allow me to complete this entire list. And lastly, if you're flared up, be kind to yourself, right? Give your body the break that it needs. If you need to scale back for a day because of that flare up, or 3 days or a week, that's okay. Your body is asking for you to do a little bit less, and you know for a fact that you have done your baseline before and you'll get back there. Just give your body the break that it needs and ramp back up when you're ready. And keep in mind, there are lots of resources online for helping create pacing plans. A quick Google search of pacing chronic pain will probably pop up a couple of resources for you to look through. So thank you so much. I hope this was helpful, and best of luck with your new pacing endeavors.